school, the School of Dentistry, and I'm going to talk a little bit about Dundee, dentistry, and the course that we run in Dundee, and I'll be followed by my colleague Dr. Fiona Stewart, who is the admissions tutor, and she'll introduce herself in due course. So what I thought we'd do is, first of all, yeah, I'm a member of staff here. I'm actually a graduate of here as well, many years ago. So I came and sat in your sort of seat, as it were, back in the 80s and made the decision to come to Dundee. So what sort of things impact that decision? Well, one thing I think is the place. So just obviously you're not visiting the place, whereas normally you would have that opportunity. And if you do get the opportunity, I would suggest you take it. Then we'll talk a bit about Dundee life, and then the curriculum. Okay. So here is a picture of Dundee that I took a few months ago. Dundee, if you've not been before, is on the east coast of Scotland. It's a mid-sized city, and I think our biggest claim to fame is we are situated on the River Tay. So this view is taken from the Kingdom of Fife, where I live, and up in the middle of this picture is the bridge, the Tay Bridge, and the city Dundee is at the end of that bridge. So we're on a waterfront, a huge, relatively unpolluted waterfront, which makes our situation quite unique. And even more so when we look at where the dental school is, which is here, which is where I am at the moment. I can look out from my window out across the river and out to sea, very close to the sea, which is a great place to be. If we look at a different view from the same spot, you get an impression as to how big the River Tay is. This is actually not looking out to sea, this is looking inland towards Perth. It gets wider, and you can see the bridges, the road bridge, and in the distance you can see the railway bridge. So it's a city, it's a compact city, but a city that's got a rather unique situation, being right on the river. And you can see in the distance here what is the start of the hills, and then that ends up in mountains a short drive away. So Dundee, a well-connected city on the river, essentially on the sea, and very close to the mountains. So it's a good place to come. It's also in the news a lot for this building, which, as you see, as a reflection, is the V&A Museum in Dundee, which has really put, not that Dundee needed to be put on the map, but it's put Dundee on the map in a different way. It's a museum of Scottish design, and as a building, it's, as you can hopefully see from this image, it's architecturally quite striking. So we get a lot of tourists now just to see the building, for example, and to visit this museum, and that's part of a massive development of the waterfront down in Dundee. And we're about to get an Eden project that's in the pipeline, and lots more really exciting developments that are happening in these recent years. So much so that Dundee is a cruise destination. The cruise ships are back in town. This was about 5 weeks ago. A big one came in, and to bring tourists to Dundee. This is our second bridge, or maybe it's the first bridge. It's the older of the two. It's the railway bridge, which famous for falling down, but they've rebuilt it, and this is the new one, and it's been standing for a very long time. But it reminds me that Dundee is well connected, not just locally to the wonderful countryside, but that's a train going to London. You can get direct from Dundee to London numerous times a day. So Dundee to London, Dundee to Edinburgh, just over an hour, Dundee to Aberdeen, and Glasgow similarly, not much over an hour by train. And you can get up to Inverness via Perth and the Highlands very easy. So it's a well-connected city. And closer to home, within a bus ride, you've got St Andrews, which is a famous town, famous university town, but also a famous town if you like golf. But actually, it's a lovely place just to visit, with 2 lovely beaches and a very historic place. So it's a great place to come and study, and that's a really important thing, I think. When you come to dentistry, you've got choices of dental degrees all over the UK and beyond. So a lot of it comes down to, where do I want to live for 5 years? And seeing Dundee, which wasn't anything like it is now, when I was at your stage made me want to come up here, and I've not moved away. This is the campus. Dundee is a campus university, and it's a compact campus, which is great for the student experience. The dental school is this tower where in this circle over here, and it's on the edge of the campus, and you can see, whoops, wrong way, let's try to get a pointer. We are very close to the library, which is just down here. I hope you can see my pointer. The halls of residences, many of the residences are here, and many students live around here and here, particularly in the early years. We've got sports facilities here. We've got the student union, or Dundee Student Association, as it's referred to as, which is a great hub for not only sort of social life, but support both from the university and from the union itself. And there's a swimming pool in there as well. So we're right in the centre of, right in the campus, close to the library, but also very close to the centre of Dundee, which is just to the top right of this corner where the shops start. So it's great to be in a campus university. We use the buildings at the bottom left here in anatomy, but we also use the buildings up at Ninewells as well, which is about, you know, a 15-minute bike ride if you're fast west from here. But there's regular buses either side of the university to get there. So we're based in the School of Dentistry. Here we are on a sunny day. Dundee is a sunny city. And you can see the tower building where I am just now, and the older buildings at the front. So it's a school that's been established for over 100 years, initially part of St Andrews University. We're a school, we're a small school, but here's a selection of our recent rankings, and we've done pretty well for such a small school up here. We have done very, very well. In fact, the Scottish schools always do very, very well. In the top 3 in all these recent university and subject rankings. So let's move on to dentistry. I guess you probably, some of you will definitely want to do dentistry. Some of you might be just thinking that you fancy exploring it. Well, what is dentistry? Well, dentistry is quite a broad subject, and hence why we have such a long curriculum to gain the skills and attributes to become a dentist. So dentistry, well, you're probably used to going to the dentist for dental examinations, checkups, x-rays, things like that. And we're involved in lots of prevention because most of the dental diseases, dental decay and gum diseases, are preventable. So good oral hygiene, good diet, and sometimes doing things like sealing teeth, things like that will help us prevent, to an extent, disease. Periodontal care, where you scale the teeth, remove hard deposits from the teeth, is part of a management, even a prevention regime. Sadly, sometimes prevention fails and we get decay in teeth, and decay can be managed in lots of ways, but traditionally it's managed with a filling, where you cut the decay out and replace it with an amalgam, or more commonly now a sort of tooth-coloured filling material. But there's lots of ways to manage decay now. Sometimes, of course, fillings may fail, or things progress beyond a filling, and we have to do that affects the pulp of the tooth, the nerve of the tooth. We have to do endodontic treatment, and sometimes we have to do crowns to strengthen teeth, or crowns for aesthetic reasons. Again, sadly, we can't restore every tooth and fix every tooth, and some teeth have to come out. And a lot of what we do in dentistry is linked to managing missing teeth, and that can be with fixed bridges, where we attach false teeth to adjacent teeth. We can place removable dentures, and we can more increasingly common now place implants to replace teeth. So that's very much a tooth focus, but dentistry is much more than that. There's the mouth and general health. Well, if you can't chew properly, you can't take food in properly. So that's important for health, maintaining function. Many diseases will actually present in the mouth before they present elsewhere. And as dental professionals, we are very attuned to detecting abnormalities in the mouth. And sometimes we can pick up a disease elsewhere in the body. Sometimes very, very serious diseases we can pick up by changes in the mouth and literally save lives by diagnosing certain, or certainly pointing patients towards their medic, their GP, to get things investigated. Some patients have infections in the mouth of the soft tissues, and sometimes that's because they are not, that they have problems with their immune system, for example. Again, general health. Oral cancer, sadly, is a disease that's not decreasing. In fact, it's increasing, particularly in younger people. Its treatment prognosis is good if it's picked up early, but if it's not picked up early, its prognosis is poor. So our role as dental professionals is to be on the front line to pick up the earliest signs of oral cancer. Patients have trauma, they fall off their bike, they fall over, they sadly get beaten up sometimes. So trauma is an element of our care, managing fractured teeth, but also fractured jaws if you end up in more specialist work. Some patients have pain conditions, not just toothache, but chronic pains in the jaws, in the joints around the jaws, in the face as well. Pain conditions, pain in the face is not nice. Patients have developmental conditions. It may be something like a missing tooth, a tooth that's not formed, or teeth, or it could be something like a cleft of the lip or the palate. Dentists are involved in that. Patients are keeping their teeth longer. So a much more increasingly common problem now is tooth wear, as teeth erode and wear away. And that creates a complex management issue, particularly in older people who are keeping their teeth for longer now. The days of dentures when you're 21 are long past. And some dentists devote their practice to aesthetics. Cosmetic dentistry is big. So dentistry is a huge topic. It's therefore the curricula that we have to deliver to give you those skills is naturally quite complicated. So, and this is a common picture out there on sort of social media. Dentists are sort of in part doctors. You have to understand a lot about medicine, but in part engineers. They are people that we make things. We're very much technical people. And in part, we're artists as well, creative individuals, and hopefully you have that sort of creative side to you that would make you a good dentist. So if we look at the dental courses, these are documents that are worth looking at. We're regulated by the General Dental Council. And as dentists, this green booklet here, that you can get them all from the website of the GDC, is the scope of practice. And it tells you what dentists can do, what dental therapists, hygienists, dental nurses, etc. can do. The grey book is what the public expect from us. It's the standards that the public expect us to abide by. And this final booklet here is preparing for practice, which basically governs what we as a dental school must deliver to render one of our graduates fit for registration at the end of the day. And all dental schools must conform to this document. All dentists and dental professionals must conform to these, but this one on the right is what we as a school must demonstrate that we fulfill, so that when you graduate with a BDS from Dundee or Glasgow or Newcastle or wherever, that you're fit to be registered by the GDC and therefore able to practice. So dental schools have a job. We take in a cohort of students, new students. Now, traditionally that was school leavers, and the majority of our new students are obviously school leavers, but an increasingly number of graduates or students who come through different pathways. So we take in quite a diverse group of students, and our aim is to initially transition you into being a student dentist, a clinician that works under supervision of staff, delivering care and expanding and enhancing your skills as a student dentist. And then the final stage is to transition through graduation into the next stage of your training, which is normally some sort of vocational training or foundation training. So each dental school does that. It takes a group of students and helps support them to become a student dentist, and then supports them as they leave at the other end. And what's different, I suppose, between the schools is we all have the same outcome at the end. It's how that journey goes and what that journey is like, because we all do it in different ways. Now in Dundee, back in 2018, which is a fair way away now, we introduced the 4D curriculum, which is Dentistry at Dundee, driven by Discovery. Discovery is the name of a ship that is very much part of Dundee history, but Discovery is kind of part of what this course aims to do. It aims to produce students and graduates who can think and direct their learning. We're not a problem-based curriculum. No way, we're not a problem-based curriculum, but we are encouraging a lot more student-driven learning. The aim of the program is to produce graduates who put the interest of patients first at all times through being caring, knowledgeable, skillful, safe and reflective practitioners who are not only able to maintain registration with the GDC in the case of the UK or other body as lifelong learners, giving you these skills, but have the potential to be innovators and leaders in the profession. So what's the key bits of the course? Well, one of the key things is supporting you through these different stages. You come into university from a various backgrounds. Initially, we support you as to become a learner and to understand what it is to be a dentist. We don't deposit you straight into membrane physiology. That comes later on, but initially you're here to be a dentist. We talk about and discuss the role of dentists in the community, dentists and dental team, dentists and professionalism, dentists and the GDC, all these sorts of things. And then we have a transition from that to a student dentist. Now, when I was a student, that was a sudden transition at the end of second year, where you suddenly started treating patients. In this curriculum, we start clinical activity right at the start of the course. And what the aim is to have the skills to be able to start seeing patients for very simple things during year one. So in year one of the course, students finished end of year one had actually seen a small number of patients, which was a great motivator. And then we want to transition you out the other end as graduate dentists. Key to these transitions is integration. We don't split the science from clinical. We try to integrate the science and clinical together. So the clinical and science are interlinked. The science is demonstrated as relevant by the clinical practice. We try to engage students, so we want learning rather than just sitting you down and telling you what to do. And that's not through how we deliver the learning, but also how we deliver the assessment as well. And we look at how we can innovate with both education and the use of technology. The course is split into 9 modules, 2 per year apart from final year. And if we look, say, when you come to Dundee at first year, module 1 is the first semester. The end point of module 1 is to be able to carry out a history and an examination on a simulated patient. So by Christmas, you've been examined on skills required to examine a patient. So that requires professionalism. What's the attributes of a dentist? It requires a bit of communication skills. It requires a knowledge of how to take a medical history and to understand a bit about that. So we do some physiology and disease together. It needs a knowledge of infection control. It needs a knowledge of tooth anatomy. It needs a knowledge of how to examine the mouth. We also want to start skills development. Dentistry is a fine skill, and therefore we start to train you in semester 1 on how to scale teeth, for example. That's the very start of the course in Dundee. We do a lot of things like anatomy. Now, this is a crazy way of doing anatomy through face painting, but it allows students to be creative. This is learning about the muscles and things like that of the face and of the jaws, and the students have painted it on each other. But Dundee's quite well known, or in fact very well known, for its anatomy facility, which is kind of unique in the country. We have these special cadavers that are preserved in a way that we can not only dissect them, but we can actually practice clinical skills like anesthesia and extractions on them as well. I can't show you pictures of those for obvious reasons, but this picture sums up a different, innovative way that we do anatomy. And students present to each other what they've painted on, and this illustrates their anatomical knowledge and skills. We also use technology. We have 3D models, so particularly in a pandemic when students last year couldn't come in, they could actually learn about tooth anatomy, for example, and general anatomy from looking at 3D models that they can access on their phones or their tablets or whatever. They obviously learn about communication skills, simple things like positioning a patient, getting used to that clinical environment, so that as you build your skills, they're just stepwise increases, not a sudden everything is new. Spend a lot of time in clinical skills. You notice this, if you look at the badge of this student here, this is a student therapist, and work alongside the therapist, enhancing the dental team emphasis. Discovery is in the title, and we like students to discover, and we spend a week in semester 2 called Discovery Week, where students choose a topic of their own to research. In this case, these guys looked at social media and the perception of dentistry on social media. So we want an engaging course. We want a fun course. University life should be interesting. It's very hard work, there's no question, but it should be enjoyable. We try to do that. So as the course progresses, in module 2, for example, you'll learn how to drill teeth, for example. Learn the basic skills to drive a drill. And then you'll start to apply that to the management of decay, dental caries in module 3. And then by module 4, the idea is that you're actually doing it on real people. So the end of second year, doing a filling. That requires things like anesthesia. So you can see how things build. Third years, learn about replacing missing teeth and extracting teeth. The skills build throughout the course. So students work in pairs. They're supported by nurses as well, carrying out simple work. And it gets more complex as we go through. We have well-equipped surgeries with microscopes, for example, for endodontics, quite cutting-edge facilities. In part, the students drive what we do. This is a very successful Dundee project where they've changed the perception of dentistry through Wikipedia, and Dundee students have set up this big global network of students to edit Wikipedia pages. It's off their own back. As staff, we support it, but they do that themselves. Very successful student-led projects for these highly motivated individuals. What are we doing for COVID? Well, one thing we're doing for COVID has obviously impacted the way we do dentistry. This is the 4th floor clinic. Dundee's done a lot of work to mitigate the risks of COVID, certainly in a cross-infection perspective. And you can see normal dental chairs at the left, but on the right got these grey pods, and inside those are dental chairs, which allow aerosol generating procedures like drilling to take place in a safe environment and with enough air suctioned to remove the air, so we can actually supervise, to suck out the aerosols, so we can get in and supervise patients and students effectively. The dental school's changing. Not only are these pods being put up, and let's hope that they're not required forevermore, but I took this picture at lunchtime today. This is a brand new clinic. Levels 3 and level 2 are totally new. But this clinic opens on Wednesday for the first time, and it's a brand new, refurbished student clinic, which will mean that all our clinical facilities are very, very new. These big partitions are an impact of COVID, sadly, to keep things more separated, but this is a brand new clinic that we have. Just to finish, dentistry is tough. It's a tough career. It's a tough course. There's no question. But our aim is to support you through that. Your dental course is tough because you're expected to behave like a professional. You're doing patient work particularly early on now in the course, which is hard. Patients can bring their own difficulties, especially when you're very new to it. There's the demands of being a clinician. There's the academic demands. A lot of dentists are perfectionists. That creates its own little problems. New challenges away from home, new colleagues, finances, accommodation, health and family can all bring together to make life sometimes a little bit difficult at times. We have a student support network in the school through advisors of studies, mental health first aiders, welfare ambassadors, a whole array of support in the school. And we are blessed with a really good array of support within the university as well. So if you choose to come to Dundee, we hope that it's a place that you would not only thrive as a student, but also feel well supported so that you can get the best out of your time here at university. So there we go. That's enough from me. And typically I've run over slightly. That's an overview of what we do in the Dundee and the course. Okay, so thank you very much. I shall now pass over to Fiona. If I stop sharing the screen.
Thank you, Andrew. I shall share my screen now. Okay. So I'm going to talk to you about how to get into dental school. Andrew's told you about the course that you would get into, but there's a whole procedure that you have to go through to before you get made an offer for dental school. So in terms of what is required, there are certain non-academic requirements that you would be expected to meet. The first thing is work experience. Now, work experience is not essential at the moment. We advise people to do a couple of weeks of work experience, but it's really to decide and to find out that dentistry is a correct career for you. That said, work experience is really difficult to organise and has been for the last year and a half during COVID. So alternatives and ways that you can find out about dentistry and working in the profession would be to speak with a dentist. Perhaps your own dentist might have time to speak with you at lunchtime or the beginning or the end of a day, or an existing dental student. If you ask at your school, there might be someone who has gone off to study dentistry in the last few years that you might be able to hook up with and ask them. Or you can read about how COVID has affected dentistry and healthcare in the press, and there has been quite a lot of information in the press about that. So there's quite a lot out there to read up on, and it just tells you about working in dentistry and what it would be like, and what kind of person really you need to be to work in a profession, in a healthcare profession such as this. And this slide is just a list of some of the things that we think are traits that would be relevant and important for someone coming into a dental profession. So, hand-eye coordination is really pretty much a requirement. If you're not very good with your hands, then maybe think about whether dentistry is the career for you, because you're doing there's a lot of manual dexterity involved in it. Dentistry, as Andrew has mentioned, dentistry is all about working in a team. So to have experience of working in a team would be really useful. There's also a lot of reflection involved in the dental course and throughout your career. So that's important to just have a little bit of experience or think about that. And you really need to be a caring person. You want to work with people, empathic, be a good communicator, and just solve problems, because dentistry, a lot of it is about seeing a problem with a patient and trying to resolve that for them in the best way that you can. You need to be pretty organised in a dental career, and honest. But, all these, along with all of these traits, you need to have what I always refer to as a safety valve, which is some way to relax that's really nothing to do with dentistry. So it's very important that you have hobbies and interests out with the profession for just relaxing. And that might be, I don't know, it might be craft work or reading or music or sport or whatever. But it's really important to keep these interests going. Now, there are certain contextual factors that the university gathers centrally about all of our candidates, and that can affect the entry requirements that are required for different courses. So there's information about this on the university website, but these are just some of the contextual factors that are gathered by the university team. Now, the minimum entry requirements, if you do not have any contextual factors, the minimum requirements are 4 A's and 1 B in hires, all taken in the one sitting, plus advanced hire biology or chemistry at a B grade. That's for SQA candidates. For A-level candidates, it would be 3 A's. To include biology and chemistry, and the IB would also need 37 points and biology and chemistry at the higher level. We also have graduate candidates who apply, and for that you would need an upper second class or better honours degree in a life science subject. For the candidates with contextual factors, the entry requirements are slightly different, and actually you can achieve these grades over 2 years, so over 5th and 6th year for Scottish candidates. So it's 3 A's and 2 B's at higher, to include A's in chemistry and biology, and an advanced higher chemistry or biology at a grade B. And as I say, all those qualifications, those 6 qualifications could be spread over 2 years if you wanted. If you come in through that entry route, then you would have to do the university's Access Summer School, which is a really super preparation for university that runs usually from about late June to late July. And it's received very positive feedback from our entrants who've done that in preparation. Your personal statement, I know that most people spend a huge amount of time on the personal statement. To be perfectly honest, we do not use our personal statement for selection to interview. We might base some questions at interview on the personal statement, but it is not rated or graded or scored or anything like that. What it should include, however, is why you want to study dentistry, what you've done to find out about working in the dental profession, and how you have shown the traits that would be important for someone working in a healthcare or dental profession. So yeah, things like the team working activities and communication activities that have involved communication and stuff like that that you've been involved with to date. The reference is quite important, and it's an opportunity to pass on information to us about any Well, first of all, how prepared you are to study dentistry, and also any adverse factors that might have affected your ability to perform to your best academic potential that you've encountered. It also is an opportunity for the school to say whether there have been restrictions on either the number or the subject of hires or advanced hires or whatever that you've been able to do at school, because that can affect the entry requirements sometimes for some candidates. So it's important that that's put officially in the reference, which usually comes from someone at school. Now, UCAT is an essential part of applying to dental school. At the moment, we're kind of mid-cycle for this year because it runs this year from late July to late September. I would imagine that anyone who is applying in October of this year has either already taken their UCAT or has booked a date for it. So most people will have been prepared for this year's cycle. For anyone who hasn't yet, or who is planning to apply on maybe next year, then there are question banks, and there's always question banks being added to the UCAT website, and there's practice tests there. I would advise that you go through the questions initially, or a set of questions initially, just to get the feel for the type of questions that they are, and then practice under timed conditions, because the timing is the issue quite often for people, that they've run out of time for the different sections of the course. There are courses that can be done, or books of questions that you can do. It's difficult to say whether these would help or not. Some people think they do, some people think they don't, and I know certainly that people can get very good scores on UCAT without paying money to go on courses and things like that. So you can do a lot of preparation yourself online for the test, and I'm sure that's sufficient. You can only take the test one time per entry cycle. There are various forms of the test. They call them different access arrangements. So, if you get extra time in exams at school, then there is a form of the test that will allow you to do that as well. And again, full information is included on the UCAT website. There's also a bursary scheme that will pay the test fee for those who are eligible. In terms of the UCAT score that you achieve, I'm always asked what a good UCAT score is, and it really it varies quite a lot from year to year. The scores are compared with the other candidates that we have in the same entry cycle. So, you might have a year where the candidates all score slightly higher, or another year where the candidates all score slightly lower. So I think the most useful thing to do is to give you the average UCAT score for people who've been invited to interview, and in the last cycle that was 2,555. That said, we expect competition to be quite high for places next year, because not only have we had the deferred entry, so that last year's candidates and this year's candidates would all be starting the course in September of 22. We expect quite a number of the candidates who were rejected in the last cycle to reapply this cycle. So I think there will be quite a lot of competition for the places. So that in terms of competition, that may push the average score up from what it was last year for invitation to interview this year. When we're selecting for interview, we score everyone's application for their academic achievements. And so for school leavers, we use 60% the academic achievement, score and 40% your UCAT. We divide UCAT scores into deciles and use the decile for that 40% contribution to then select people from all the applications for interview. For graduates, the proportions are reversed, so it's 40% academic and 60% UCAT. We will be holding our interviews online again this cycle, and they will be an interview with a number of different stations or themes within them. The interviews will last about 35 minutes. And there will be about 7 stations, 5 minutes each. And they talk about, you know, there will be opportunities to talk about how well prepared you are for studying dentistry. We might have discussions on various different topics. There will be probably a role-playing task to do as well. And we're really assessing the attributes that we think are important for someone coming to study dentistry. Following the interviews, the interviews are all scored by 3 different individuals, and that leads to a ranking list, and that's how we make the offers for entry to the course. In terms of timeline, you are probably aware, certainly people who are applying this year, that the deadlines to UCAS is October the 15th. That's the same every year. We will be holding our interviews online, usually between the period of December to February, but there may be some candidates who are contacted later in the cycle to attend for interviews. So if you do apply and you don't hear back immediately or quickly, then please don't panic. You know, it could be that you're invited to interview later on in the cycle.